Okay, I'm so glad to present my special lecture today at a week conference. Actually, last October, I gave my lecture at the classroom of your BINUS University, but this year it is sad to be giving this lecture online because of COVID situation. However, today's my lecture is about how to overcome COVID using ICT technology in Korea. So I think it is good to use online technology for this lecture. So I hope our experience using ICT technology to overcome COVID will help you to solve the difficulties of your country's COVID situation. Okay, now let's start my lecture. So I will cover these topics today. First, I'll make a brief review about starting and the current COVID situation. And then I'll present the application method of ICT technology by grouping them into three categories: the prevention plans, infected person tracking and tracing method, and AI-based COVID treatment and vaccine developments. And then I'll talk about some new laws related COVID, followed by concluding remarks. Okay, as you know, the COVID-19 started on December 1st last year in Wuhan, China. It occurred in Korea on January 20th this year by the woman returned from Wuhan city. And it started in Indonesia on March 2nd this year to two women contact with the infected Malaysian. Is that right? Well, this map shows the global early spread of COVID-19 on February 17. At this time, the total number of infected people is about 71,000 something. Okay, and 99% occurred in China at this time, and then Japan, Singapore, then Korea was about 30 infected cases, but not yet in your country at this time. From mid-February, I don't know why this is, let me pencil. Okay, pen. Okay, now. Okay, from mid-February to mid-March, the spread in our country was very large. This one. It increased from about 30 to 10,000 for 1 month period. But Korea began to slow down because of our effective activities, which I introduced today. However, mid-March, the spread in Europe and United States began to increase rapidly, like this. And still, these countries continue to have a huge increase in infected people. On July 1st, Wuhan report mentioned that Korea is the country with the best initial effective response to the COVID crisis among OECD countries. Okay, this one shows the early spread of COVID in Korea and also our early actions. On February 19, one confirmed patient in Daegu City traveled to several places for a week without wearing mask. So it became the starting point of tremendous spread in Korea. At the beginning of March, we started limited sales of masks and also starting running a tracking system using ICT technology. So I'll explain this one later. The second half of March, we started a social distance policy, which keeps at least 2 meters away from others. And then we also started 2 weeks mandatory quarantine for all inbound travelers. This slide shows the worldwide COVID status on this Monday. USA ranked the first with 8 million confirmed cases with 220,000 deaths. India is more than 7 million confirmed. Next is Brazil, Russia, Colombia, Spain. But your country has about 336,000 confirmed cases with a little bit about 11,000 deaths. Our country now has 24,000 confirmed cases with 434 deaths. The official total number of confirmed cases is about 38 million with 1 million deaths. However, last week, WHO announced that they estimate more than 20 times as 760 million people infected worldwide. That means it is about 10% of world population. This slide shows the daily increase of COVID on October 12th. India shows the increase of 69,000 confirmed cases on single day. It accounts for about 20% ratio of the total number. USA is about 42,000, Brazil 34,000, Spain, England, France is more than 10,000. But your country is about 3,000 or 4,000 confirmed case. But our country has about 97 people, and we had a double-digit increase every day over the last 2 weeks. So this tells that our quarantine activities is very effective in reducing the number of infected people. Well, Wall Street Journal posted an article on September 25th with the title of How South Korea Successfully Managed Coronavirus. It says that as soon as the COVID spread, Korea quickly developed a test kit. When an infection occurred in a region, text notification was sent to the local citizens with a hyper-connected communication system. When the supply of masks was short in the early days of crisis, the government took the lead in the managing mask production, something like that. So in conclusion, they mentioned that Korea is the only country in the world to solve both quarantine and economy in the COVID virus crisis. Okay, I think this is due to the quarantine activities utilizing the Korea's top-level ICT technology and their internet users. So I'd like to show some statistics statistics of the internet user and smartphone users in Korea. Our population is about 50 million. Internet user is about 92%. Smartphone user is about 90%. That means, except for children, all Koreans are connected to the internet using smartphone. Well, as online search channel, Korean prefer the Neighbor, which is a Korean-made search engine than the Google. Even on the social media, most Korean also use Kakao, which is made in Korea. We also launched the world's first 5G network service last year. So our government actually used these kind of our ICT environments for developing the some prevention plan and also some tracking systems. Okay, the first category of ICT technology is the COVID prevention plans. So I would like to present this one as 8 items. The first one is code of conduct and how to act when you have symptoms. Second one is open COVID information website. Third one is a mask distribution management system. Next one is a smart fever checking visitors using QR code, self-quarantine safety protection app, online education platform, and the smart working platform. Well, in the early stage of COVID situation, our CDC, which is a Center for Disease Control Office, prepared the code of conduct and a guideline on how to act when you have symptoms. Then they made this one as posters and distribute to all institutes and residences. And then we asked to put them on the walls and in the elevators. Cities also broadcast these contents several times every hour on major TV channels with 2 languages, Korean and English, on the bottom line of the screen. This is a sample of poster for code of conduct. So this one includes a picture with some short description for each rule. It's in Korean now. This is an English translation of the previous one. Wash your hand with soap frequently for more than 30 seconds. Do not touch your eye, nose, and mouth with unwashed hand. Wear a mask whenever you go out. Cover your mouth with sleeve or tissue when coughing. Reduce visit to place where many people gather. Maintain arm gaps, which is 2 meters between people, which is called social distance. And avoid contact with people having fever or respiratory symptoms. This is another poster for guideline how to act when you have symptoms. This is an English translation of the previous one. So when you have some of following symptoms, such as fever, cough, sore throat, or body ache, wear a mask always and avoid contact with others. Stay at home for at least 3 days while taking a good rest. Call 1339, which is a city's call center, before visiting a hospital or emergency. Use your own car when you visit the screening place. Report if you have contact someone with similar symptoms. Report contacts and visiting place in past 5 days if COVID test result prove positive, and follow the directions of medical steps. The second action was the opening official COVID information website for providing some COVID-related information. This site contains the information about some statistics, code of conduct, how to act, location of examination center, and information about the infected person's movement. However, as the number of infected persons increased, item number 5 moved to each local district website. This one shows the main page of this website. Oops. Okay, each local government and district provide a similar website. It contains the additional detailed information about the infected person movement within each district. Something like movement route, place of time of stay, transportation uses information from 5 days before the date of positive result. And then local district office send a text message to people in the same district. So it contains some outbreak news and related site information of infected person in each local area with infected person number assigned. Any emergency announcement for preventing COVID-19. This one is a sample text message, which is saying that Geumcheon district 91st confirmed case occurred. Please refer below URL for detailed information. So when you click this URL address, then you can see that some detailed movement line of this infected person. Something like June 26 from 9 to 12 stayed in the office, 12 to 1, so visit the restaurant A, 1 to 2 p.m. is use bus number 388, something like that. The next one is a mask distribution system. In the early days of COVID, which is February and March, the face mask supply was not enough. So we had to stand in the long line to buy the mask because each pharmacy was supplied only 200 masks per day, and each person can buy only 2 masks at a time. So government developed a special software quickly for managing evenly distribution of face masks and used in pharmacies from March 9. Each person can only buy 5 masks per week on their designated days, according to the last digit of the year of birth. The software checked each person's purchase of the mask and also restricted the mask parcels to foreign countries. However, at the beginning of July, the system was shut down because we got enough supply of masks. Next one is a smart fever checking. Whenever you enter a building or store, the following 3 checks are required: face mask, fever checking, and recording of visitor list. For checking the fever, we installed the smart fever checker in every public places. like subway entrance, bus entrance, building entrance, school academic entrance, even in the restaurant, cafe, or church. Then automatic alarm will sound if it detects someone with a temperature of 37.5 degrees or higher. We also installed this one at immigration gate in the airport for checking the body temperature of inbound travelers. This is a regular thermometer, which is used at some restaurant or cafe. This is a smart fever checker at the subway entrance. This is another one at the bus entrance. This is a picture of me taking my temperature at the entrance of my office building. The next one is checking visitors using QR code. Each building and store must make a visitor list. There are two ways to create an electronic access list of visitors using QR code. The first way is to create personal QR code and check it on the entrance code reader. So you select the QR check-in menu at the Neighbor or Kakao app. At this time, you must use your own mobile phone. And then you read the personal information consent guide and click the agreement button. Then one-time QR code is generated like this. And then you have to check it on the entrance code reader like this. The second way is to check the QR code of each building or store with a special app. The people must download Access Safety Confirmation app. Then the people recognize the QR code of the building or store at its entrance using this app. So something like this. So when recognition is complete, you must click the confirmation of consents to personal information, and then you will get this kind of confirmation screen window. So you have to show this one to the entrance inspector. If this is not available, then each business unit must make a visitor list on the paper. The visitor information obtained in this way is used to trace the close contact person with the infected person later. The next one is self-quarantine safety protection app. Self-quarantine is required for two cases. The first one is all international arrivals must have self-isolated for 14 days. They are not allowed to go out from the designated place, which is own home or government-provided facilities. The second case is the people in close contact with the infected person, like eating together, talking together, living together, meeting together. In this case, they must stay at own home for 14 days. But in this case, they must download this protection app. This app supports the monitoring of those people under self-quarantine. So this app is used to monitor their conditions and conduct self-diagnosis and ensure that self-quarantine orders are kept by setting the alarm and notifying to the case officer when the person leaves the designated quarantine place. It's about 10 meters wide. It is also used to report the quarantine person's self-diagnosed information on the daily basis, like any symptom and body temperature. This is a sample screen of this app. So self-quarantine safety protection app. Then you have to register your quarantine location when you arrive at the designated place. We also provide a self-diagnosis mobile app called App Self-Check-It. This one is developed to monitor symptoms of inbound travelers every day. And it also provides user-friendly medical services. This is the main screen of this app. Okay, every school nationwide starting online classes the whole year. I know your country is also doing the same way for education. But we support online classrooms with various online platforms. You know, there are two ways, one way or bidirectional. So EBS, eStudy Room, Class Team, Google Classroom, Zoom, Google Meet, something like that. Our government also support the free IT devices for studying to low-income students. This graph on the left side shows the number of users for each education platform. So Class Team, Zoom, and the Classroom at the top level. Right-hand side graph shows the total usage time for each platform. So it also, shows that Zoom, Class Team, Classroom are on the top list. The next one is a smart working platform. The office workers are working through ICT-based online meeting platform. So this one eliminates the need for physical contact between participants. So our government provide the guideline to work at home using Korea's ICT infrastructure. So they recommend companies to have 1/3 of workers to work at home. So we also support the cybersecurity guideline for staff working remotely. Well, here is 2 examples for platforms. Naver, which is a Korea ICT company, provide a free remote working platform called LineWorks for small and medium-sized business. It supports most functions required for company work, such as a schedule sharing, team meeting, or a video conference. Kakao, which is another Korea messenger company, provide a work platform, Kakao Work, which is developed by using the Kakao interface that most Koreans use. We also provide a remote Medicare system, which permit the doctors to perform telemedicine to avoid the group contagion in vulnerable facilities. It supports the phone consultations and any prescribed medicine. We also launch a mobile application for remote diagnosis called Coronavirus 119 app. Okay, the next category shows the important things to overcome the COVID. Infected persons tracking and tracing using ICT. First one is a screening test. Second one is a movement tracking system. based on the big data. Third one is a contact tracing for infected person. If someone has suspicious symptoms and suspect COVID, they should get the consultation from 1339 call center first, then visit a screening center. Government provide a list of screening center on CDC website. If the test result is positive, the person with a severe symptom is transferred to the hospital. The person with mild symptom is transferred to an isolation facility. The CDC officer investigates the infected person's past 5 days movement in detail and make a list of persons he or she met. This data is used to find out where and from whom it has spread, and also used to find and inspect close contact persons. The second method is a movement tracking system. This system is developed to find out all movement of infected persons using detailed questionnaire data with infected person and big data information such as credit card usage history, public transportation card uses, smartphone location history, and the CCTV, etc. The left picture shows the location of the infected person with the number assigned in a specific area. The right-hand side shows the movement of the specified infected person as a graph, something like this, okay? After finding this kind of movement information, we take 3 actions as follows. The first one is this information is uploaded on the local district website. However, this information is only valid for 14 days to protect the personal information. The second one is to send a text message to people near the contact line for last 5 days and to residents in the same district. The final one is very important. We send a text message to people who are in the same place at the same time period, which is about 30 minutes, to get a COVID test. We also notify to person in the close contact for taking a test by phone. This is a sample text message from local district to people in the same district. Okay, Mapogu district, number 56 confirmed case occurred. Please check the below address for detailed information. So when you click this one, you can see the detailed movement information for this person on each day and time with some location. And then we send a text message to people whose movement line overlap with the infected person to get a COVID test, screening test. So this one is like an infected person's movement line, something like this. Okay, then send a text message to people, something like your movement on June 9, 3 p.m. overlapped with Jongno-gu number 120 infected person. Please check it and let us know if it is right. So that means government access everybody's movement using their smartphone. So using all of this method, we isolated to the infected person and also prevent further spread by finding the close contact person to take a screen test. The next category is about the AI-based COVID treatment and vaccine developments. There are 3 items in this category. The first one is AI-based diagnosis kit development. Second one is therapeutic drug development. Third one is a vaccine development. In 2015, MERS virus pandemic, we create a white paper, which is a guideline to combat the infectious disease. We also experienced the utilizing of RT-PCR test equipment to diagnose infectious disease. And it was based to develop COVID diagnosis kit quickly. Pharmaceutical companies collect AI-based genetic big data information to develop the diagnosis kit. They used AI technology and supercomputer to improve the accuracy of the diagnosis kit. So they supplied this diagnostic kit from March, and currently we are exporting this kit to more than 150 countries around the world. During the first half of this year, the diagnostic kit exports increased more than 13 times over the same period of the last year. Now it has increased much more. But these are the diagnostic kit export samples, something like that. Okay, the second issue is the therapeutic drug developments. In general, it takes at least 5 years to develop the new drug candidates and takes another 3 to 5 years for conducting clinical tests. That means we have to wait almost 10 years. However, AI program to find the COVID treatment candidates enable the development of new therapeutic drug candidates within 6 months. It can also shorten the clinical test up to 6 months. That means it will take around 1 year. So we expect maybe next spring time, if it is successful. There are 2 ways to develop this drug. The first one is that to use AI deep learning technology to search for treatment that have the closest molecular structure to COVID-19 among existing antiviral drugs and use them for COVID treatment. This is now under treatment. The second one is to use AI program to find the compound structure that blocks virus protein by trying to synthesize various compounds. The first method starts by analyzing the commercially available antiviral drugs using drug protein interaction prediction AI algorithm to determine whether they are applicable to COVID virus. And then it continued to learn the information of all antiviral drugs by designating the ability to bind to viruses as an evaluation index. And finally, it performs the validation of actual effectiveness through clinical tests. The second method uses AI program to find the compound structure. First, AI program learn about 1 million compounds very quickly. And then it create 100 hypothetical compounds each time and check if they match the desired properties of candidate. After this, it repeats this trial to find the structure of compound that blocks the protein of the COVID virus. And finally, as designed by the AI program, robot or 3D printer chemically combine the therapeutic drug. Well, here is the two examples. The first one is Diogen, which is a Korea AI drug development company. They use AI technology to predict the effectiveness of COVID treatment of existing drug. Another company, JLK or BINUS, they use AI medical image diagnosis for chest CT to reduce the test time to 20 seconds. The third topic, which we are really waiting for, is vaccine developments. AI program analyze the property of a large number of pharmaceutical compounds, search for RNA suitable for antibody properties, and conduct experiments. Okay, the first step is to analyze antibody characteristics in the blood of the existing COVID patient. Based on extensive analysis data, the RNA structure suitable for antibody characteristic is searched. And then human cell read this RNA to make viral protein antigen. The next step is to cause the body's immune system to make antibodies against this antigen. Before clinical test, AI analyzed the human reactions and results through various simulations. When the practical clinical tests are conducted, analysis of clinical outcomes and responses are performed. As you know, clinical tests must go through at least 3 stages. It also provides a visualization of result data to make judgment quickly. If the vaccine development is successful without other side effects, we expect the vaccine to be developed in the middle of next year and take 1 or 2 years to complete the vaccination for most people thereafter. In order to carry out these quarantine activities in efficient way, appropriate laws have been revised. The first one is to add new definition of suspected infectious disease. We also made some revisions for the basis for quarantine and checking of symptoms using ICT technology for suspected person. It also provides some basis for using equipment such as information devices, image information processing devices, and electronic detectors for quarantine. However, their personal information is only used for tracking of infected person. government is not allowed to use this data for other purpose. One important item is that penalties for violating this quarantine. 10,000 US dollar or 1 year in prison. Another penalty is that if infected person make a false statement and interferes quarantine activities, maximum penalty is about 20,000 US dollar or 2 years in prison. It's very strong. Well, our country established several measures to overcome COVID-19 using ICT technology. So far, this method have proved very effective to overcome the COVID virus situation in our country. Through all of these activities, we have learned that ICT technology helped prevent COVID-19, including quarantine. ICT helped find and trace quickly for infected person and the contact person. AI technology is usefully utilized in development of COVID treatments and vaccine. It can reduce this development period from 10 years to 1 year. I hope that Indonesia also apply this kind of ICT technology well and overcome COVID-19 quickly. However, even if we create a variety of quarantine systems like this, they are useless if people do not follow them. Most of Koreans follow the government recommendations and regulations well. This is another part of Korea's successful quarantine status. As you know, America and Europe have a problem with this aspect. They don't want to wear a mask. They don't want to get some limitation of their movement. They don't want to provide their information about their movement, something like that. Okay, now I'd like to state my last word. We must do our best to turn this crisis into opportunity for the world to pursue peace and happiness together as one community. We are the one world. So I hope to see you all face to face after COVID is quickly over. Maybe next year or the year after next year. Terima kasih. Thank you.
All right, thank you, Professor Kim Jaeseok, for the talk. It's actually really frightening to